I don't think so. Okay. Good morning, everybody. Welcome to the JAR Foundation Live. This is a brand new podcast that we've put together from the JAR, the regular JAR podcast, the traveling show that I do with my team. This is a new one focused on mental health issues specifically, and bringing people who are somewhere in that journey along the mental health industry. Whether it's a patient, a provider, a therapist, policymaker, or somebody in the fundraising side that works with nonprofits or other institutions to deliver mental health services across the country. So, in my journeys with the JAR podcast, came across so many stories of people struggling in real life or have been through struggles, and surprised to see how little tools there are for people to manage things themselves, how little there are tools to slow slides down hills for people in the mental health when they're going through crisis and things in their life. So my first guest is Neil Colvin, and he's a founder at Thera Fi. And so Neil and I just had a pre-chat before we're jumping on here live for everybody listening. And so Neil, why don't you spend a few minutes, introduce yourself, who you are, where you're at in this journey of mental health space, how you ended up here, and then we'll talk a little bit about, I guess, what Thera Fi is doing and what you're hoping to do.
Sure.
Over to you, Neil.
Thanks for having me, Ken. My journey's been interesting for sure. It's definitely didn't start off in the mental health world at all. In fact, my initial background coming out of college was nuclear security, so the Cold War stuff.
Okay.
I joined the Air Force to see the world in Omaha, Nebraska, and I was hoping to go someplace cool. And they actually stationed me in my hometown. I was devastated.
So that's a mental health crisis right there.
Yeah, it sure was. I was like, oh my gosh. So I was like, hey, Mom, Dad, I'm going to be stationed here. Can I stay with you guys right after college, and I can pay off my bills real quick? They're like, sounds cool. We're moving to Ohio. I was like, no. So that plan went out the door, and I was like, all right, I guess I'll just buckle down and work. But it was 12 years of just traveling to different states or different countries. So I went from Nebraska to Germany to Kuwait for a year. Then from Kuwait, I was supposed to get to choose where I wanted to go. Ended up sending me to North Dakota, Minot, North Dakota, which was that was like the last place on the planet that I wanted to go.
I did 4 days in Minot with the JAR. It was great. I had some great guests.
Yeah, I'm sure they were eager to talk to somebody. They're like, hey, welcome. We're 20 minutes from Canada. Yeah. Did you go in the summertime or was it winter? I'm guessing it was warmer out.
So it was summer.
Yeah.
Late summer. And actually, Minot, I can say I was given. That's where I got COVID.
That's funny because it's so isolated. It's like, and I got COVID there.
And I got COVID there. It was like the most random thing. It's a great town. I enjoyed it.
Yeah. So it definitely was a nice town. I just happened to go there because there was some nuclear incidents that were national at the time. They made the news, and so they're like, "You don't get to choose. You're going here because we want you here to help this out." Did really well there, but I attribute like my grind with work from learning nuclear security, which is basically either get 100% or fail for everything. So it was tough. And so when people go there, I'm like, hey, awesome. I'm glad that you got there. I know you didn't really pick it. It picked you, but it's for a reason. It's because they saw something in you that they knew could drive.
Right.
Yeah. So from there, finished up with my career in the Air Force at 12 years in Texas. And from that, I went to like a very small stint in Afghanistan at NATO headquarters, Kabul, which was interesting. I wanted to go to work with NATO at some point. As soon as I joined the military, I was like, yeah, I'd like to do that just to see what it's like.
Yeah, tick a box.
Yeah, and it's funny because I did it, and it was for such a short period because when I'm there, I also got notified, hey, the military is shrinking. you went from nuclear security. If you would have stayed there, you would have been fine. But you happened to come to Texas, which was the education world for all the tech students for security. And then from there, you went to Afghanistan, so you're out. You don't have any backing right now in this little spot. So I was like, you know what? I'm fine. I kind of hit everything that I wanted to hit, and I knew where I'd have to go next, which would have been back to like either North
Yeah.
Dakota
Right.
or Minot, Wyoming, Montana, and just cycle through there. And I was like, meanwhile, I had friends that were flyers, and so they're like, I've deployed to Florida, and I was like, this is ridiculous. I mean, I want to go to Florida, but like, nah, not in your career path. So I was like, that's fine. I wanted to definitely like get out and see the world as a civilian. So from there, moved to Ohio,
Okay.
and met up with my parents, and that was it was a tough time because I was also going through a divorce
Oh
due
man.
due to my ex with mental illness, and make it tougher. My dad was stage 4 at that time with cancer, and so
Wow.
it was kind of tough to go through all that. But it was a time that I was like, wow, timing's everything. It allowed me to like have no
Hmm.
other things that I had to work with at that time except for like just reconnect with my parents
Right.
for this last few months, which I'm thankful for. And they connected me with some great people at a church out in Sunbury, and those guys were definitely age demographic, up here. I was the youngest guy. I'm in my 40s, and so I was a young guy. Um,
Oh.
but super great people to meet, and I'm still friends with a lot of them. But I've moved to since then to the Columbus area, and I still stay in touch with all those guys. Um, but from that, after that, I ended up getting a few different jobs, like in the tech world. Worked at Amazon logistics, and then went to Rickenbacker International Airport and figured out logistics there, air international logistics, which was tough. So I was just transforming each time, and then did a few like side gigs, and then eventually worked at a tech startup called VPL, and
Yes.
met some great people there, and that was a lot of fun. But everything shifts with COVID, and so at that time, that was basically managing data for hospitals, universities,
Yep.
pharmacies, and that was kind of like my first little feet in the door there for that kind of stuff. And I was like, all right, if these guys can do it, and it's a startup, like why can't I do this?
Hmm.
And at the same time, I'm talking to my ex-sister-in-law, which hey, through the divorce, end up meeting my ex-in-laws, and reconnecting with them really well. And she was just explaining to me, she's now like an older sister to me, and we won't say how old she is, but she's a little bit older. And she's like, hey, you know what? I'm a hairstylist in Chicago. I love it. I own my own salon, but I'm going to get into mental health. I want to be a social worker because of her sister.
Okay.
And I was like, oh, that's awesome. Good on you.
Yeah. Good. Yeah.
And then she was like, well, I've done my research, and it turns out that I'm gonna make exactly like half of what I make cutting hair if I go to. Yeah, I was like, dang. So
I mean,
I was
cutting
like,
hair is, and you're not making a lot of money cutting hair.
no, you're not.
So
I
you're
think
half of that.
yeah. And so she's like, I if I go get an associate's and then I get a bachelor's and a master's, I'll get half. And I was like, something's wrong. Because mental health and anything in the
That's
medical
crazy.
field is expensive. So where's the money
Yeah.
going?
Yes.
Uh, the owners are basically taking the money and running with it. And so I started looking into it, talking to different people. And by the way, I also got remarried, so I have a family.
Not to
uh,
not to the sister.
not to that.
Okay.
No,
Okay.
no, no, no.
Just
Um,
checking. Just
yeah,
check.
I was like,
I had to close
I
that door.
Yeah, no, I was like, so it wasn't just me all on my own here. I was like, I've got a pretty good support structure with my wife, our
Yeah.
kids, And and so we all like, in fact, the ex-sister-in-law will be coming to visit us next week. So it's talking to her, I started researching like with my wife and her friends who are like teachers and social workers,
Okay.
and just start talking to them, and they're like, well, yeah, it's just normal this way. That in our world, we don't get paid much. And I'm like, but I'm looking at how much insurance charges for this.
Yeah, yeah.
And I'm like, or you could do private pay, which is even more, like, 250, 350 an hour. I'm like, where's the money going if you guys don't get to keep it? And they're like, the owner of the facility is the one who takes the money. And I ended up talking to a few out in Chicago, like the actual owners, and they were very open, which I won't say their names because then they'll be
Yeah.
very upset. But it is basically like, hey, I clear 500 grand a year, and I was like, wow, that's amazing. What are your How do you keep your employees? Like, who? I don't keep my employees. I work them, and then they're contractors. They're not employees. They contract with me, and then they get their foot in the door. They get their feet wet, and then they get burnt out, and then they go work for somebody else, or they switch career fields. And I was like, well, what if you just paid them more? Like, wouldn't they stay? And I mean, from working in these other startups, like
Weird idea.
turnover is extremely expensive. So what if you just invested in your employees? Like, hey, well, that's one thing that the military, obviously the military has a lot of negative things, but one thing they do is they invest in their people.
Great
I was
training,
like,
right?
right. And so I was like, what if we replicated that? And they're like, yeah, that's a thought, but nah, not for me. And I was like,
I'm,
okay,
I'm I'm making 500 grand. Why would I change anything?
right, exactly. Everything's working for me.
Yeah.
For and it's uh, a single mom with two kids, and she's just got this like small empire. Checked it with another one, same thing. They didn't say it exactly like that. That one was just very brutal and upfront, but the others were like that. And then I started talking to therapists and social workers that worked for people like that, and I was just like, so tell me your story. And they're like, yeah, it's tough getting in this business, like you got to love it. Like, yeah, you start off, you make like around 20 to 30 grand a year. And I'm like, wow, with a master's degree.
Whoa.
And they're like, yeah, but you work your way up. And then I find out like you talk to your supervisor once a week, you got to pay them. So as a licensed independent social worker, if you want to get to that level or to the social worker supervisor, you have to pay to talk to your supervisor, and they look at your notes with you. And I'm like, what world do you have to pay to talk to your supervisor? Also, in what world are supervisors that great? There's a few that are great, and you're like, that's where you learn those great lessons from. You're like, wow, hold on to this guy as much as possible. But there's plenty
This
that you
is
learn all the things. I'll never do that. I'll
I'll
be like that
never
guy.
I'll never be like that person. When I'm a boss,
Right.
I won't be that. Yeah, usually they are
Yeah.
a good example of how not to be.
Right. Yeah. So you learn tons of those lessons. And I'm like, and you're paying for this? Like,
I'm
no
like,
way.
this is crazy.
It is. And I started looking at different career paths, like so social workers, or if you want to be a behavioral analyst, psychologist, psychiatrist, psych nurses, they all end up having to go through this different steps, but it's the same route. And they're like, the hospitals don't change because they have a board and they've already established like how much they're going to pay, and it's
Yeah.
very much a deal it's been pushed out, and they're planning out for like 20 years. So
Yes.
it's like it's a big machine, and you're not changing that.
I
You go to these private ones, and they're like, well, like the lady who's like, I'm clearing 500 grand. But then there's plenty of others that in these worlds that are they went to college, they went through all their psych
yeah.
classes or their behavioral analyst classes, counseling, and they've got the master's degree, but they have zero education on business, on how to run the business. And so
Oh, yeah.
those people that want to make a difference, they can't because they don't know how to go out on their own with this. And
Mm.
it's brutal. So they have as much education as the next guy on YouTube. They're like, I can go look it up, but that's about it. So they get taken advantage of. They end up going to like these marketing companies that are like, hey, for $5,000, I'll get you a couple of leads, or buy my list. And you're just like, don't do that, guys. Like, there's better ways. But that's basically where this field is at. And so was like, let me look into this for my sister. And I started talking to the Ohio board, which was also taboo for social workers. So like they just talk to each other. And I was like, I'm just gonna go talk to the board and find out. I mean, it's COVID times right now when I was like putting this together, and I was like, I can do this. I can research this. The hardest thing I ever did in my life was the nuclear tests, so I can do this.
I'm sure I can do this.
Hmm.
Yeah.
And I was like, that or I can sit in front of the TV and keep watching, like, Tiger King. And I was like, that's actually what was the turning point in my life. I was like, dude, if people are watching this thing, I can go do something else with my life. And I watched like the first episode. I was like, oh, I got to do something else. I'm
It's so
focusing.
cringe. It's so
Yeah,
cringe. You're like, if this is what we're serving to people, I could
yeah.
be I could be a 5-star chef.
Right. And that was actually like when I watched that, I like, all right, I got to do something here.
I love
Taking
it.
control here.
I love it,
So
Neil.
yeah. And so I just started talking a little bit more, and I was like, all right, I'm going to do this. Like, there's no like actual program that says, here's how I start my business.
Right.
Um, but they
There's
were basically, these social workers were like, and the boards were like, technically you could, but why would you? You're not a social worker. You're not a therapist of any sort. I'm like, no, but I do think I could help people, and I can help the social workers, and I can help the therapists.
and
And if
so
I help them, they can help
what's the
others.
mission? What is the mission behind the company? What are you trying to
Yeah.
what part are you trying to solve?
So I'm solving the issue for the therapists.
This for the
Yeah.
therapist.
Yep. Yep. So basically, I say, okay, here's what my offer is. And boy, did I have a lot of people like, I don't believe that this works. It's not going to work. It sounds amazing. That's some pie in the sky stuff, but what's the catch? I'm like, there's no catch. I'm like, this is not like some kind of creepy sales thing of like, hey, give me your social security number or buy my pyramid scheme. It's, hey, come work for the company and here's your benefits options. I'm like, in fact, I'm like, here, let's do this. You're not going to have another boss that does this. I'm going to open up what the actual wording is for the benefits packages for insurance, all this. I'm like, let's pick the package together. And they're like, well, how do you do that? I'm like, everybody does it if they own a business. They just
Yeah.
choose to not show you that. They're just like,
Yeah.
here, you get the brown package. This is it, or package number 2. So I was like, let's pick it. And so many were like, I don't feel comfortable with this. And I was like, okay, no problem. I'll find somebody that does have that appetite to say, I want to be able to
Yes.
run this like how I want to. And I found one, and I found a few people actually. And so those therapists, I've got one on our website right now. Then I have the supervisor for them, and the supervisor was the one that's like, hey, um, I will charge, but I'll just charge the company. I'm like, good. That way my therapist doesn't have to pay anything out of pocket. And so my therapist, Sarah, was like, yeah, I'm on board. Let's see where this experiment goes and see how far we can take it. And I was like, okay, great, because we're going to start with 0 patients or 0 clients at first, and then we're going to try and build up from there. And it's been a learning experience for sure, because we had to change the way like we write and communicate with people.
Mm-hmm.
And they it's like, you think people want to hear about, like, all right, tell me what Sarah's accolades are, because I spent a lot of time like trying to find like somebody that's like this highly best in class, highly ranked individual that's polished, looks the part and everything. And they're like, that's great, but that's not what I'm looking for. What I'm looking for is just like, tell me how you're going to help me as a client. And I was like, okay, I got it. So obviously when you're going to search for a therapist, you're saying like, give me the best therapist in the world that has gone to this degree here, gone through this training here. You're saying like, hey, I have depression. I need somebody that can talk to me now. I live out in the middle of nowhere. I can't drive to a therapist. It's too time
Yeah.
consuming. And so I was like, all right, sir, let's do this. And then we ended up realizing that unless you pay like credit card or FSA or HSA, it's going to be a little bit difficult because there's all these codes. It's like, we need a billing specialist. So then we go find a billing specialist. Like, we're going to build a hospital apparently. So started going into that route and found somebody out in Illinois that is a specialist on this stuff, and she's going to grow with the company as well. So my what I told these guys or ladies is that, okay, here's where we're starting at right now. You guys take home the majority of the pay. I don't take any cut. Thera Fi will take a little bit to keep operating expenses going.
Okay.
And then you guys will take the rest. Eventually, like when we have a full thing of clients, a full caseload, and multiple clinicians, then I'll be able to I can afford to get paid at that point in time.
Yeah,
But
yeah,
we're not going for the 500K either. So this is going to be like one of those things where it's like, I'll take a very small percentage out of it. I'll be the lowest paid person in the company, because I feel like as the owner, really, what am I doing? I'm not doing the hard stuff. The hard stuff's done for me already, which was getting it all set up.
yeah.
Now it's just like these people are out there talking to the clients, doing the work day in and day out. And so, how do I help you as a clinician not get burnt out? Because it's a high turnover rate, even in the best of situations for these guys, because they're
Oh,
hearing horrible things every day, and
that's
they
brutal
they
job.
yeah, and they see things, these clients, fall off the wagon. Um, they'll self-sabotage, or it's just things that I can't do, which is I don't think I could handle working with a client that I know that will never progress in a certain manner that I would feel like is
Mm,
the best part, like 100%. Let's get you to 100%. But that's my thinking. I'm great at operations. So let me get this to operating at a 95% optimal, move on to the next project. I can't do that with a human. A human's like, hey, this is where I'm at. I'm going to fluctuate up and down all the time. That
yes,
would drive me crazy, going like, I can't do this. Uh, so, but I found the people that can, and I was like, great. And do you want to run a business? Like, no, I don't. So I want to work for somebody that gets us up and running. So I'm like, great, this is a great match for us.
perfect. What and so is it it's face to face therapy,
Yeah, so
and
it looks a
it's in Ohio,
yeah,
right? So
friend.
people can find. So if people want to, who is your client? Is your client the retail side or is it the therapist?
So yeah, that's the that's the interesting part.
Because you don't
On
know,
linked
right? Right? Yeah,
Yeah, so on LinkedIn, my client is the therapist.
therapist.
All of our advertising or the website and all that kind of stuff, that's for the clients out there
It's for
that
the
want to
retail. Okay.
that want to actually talk to the therapist. So like we're on Psychology Today or Therapy Den, that's talking directly to the somebody that's looking for a therapist.
Hmm.
Um, and so of course, like I'm learning stuff too, like, oh, how do I build out SEO so that way we can get the clients to see the therapist? Because in reality, like we're less expensive than somebody who has a brick and mortar facility having to pay for that mortgage if they're doing it out of their house, or if they have an office, or if they're at a hospital. So we're not paying for that stuff. Instead, we're just paying basically for internet, your headset, microphone, and then something that looks very similar to this right here. And you're able to log in with them and start talking with your clients. So we cut out a lot of the overhead cost, which was not possible before COVID. It was actually basically not allowed in a lot of states to do teletherapy. So it only came around just a short time ago.
Oh, well, this
And
is going to be an explosion.
it has. There's been some negative explosions, of course,
Sure,
as well.
for sure, it's
Um,
going to be some negatives.
yeah, you've had like some of these mega companies that just grew. They had the investors that go from nothing to overnight to multi-million dollar companies, and then it's not profitable, and then they suddenly, like a startup, they just collapse because it wasn't able to be sold off within 3 to 5 years.
Yeah,
And
yeah.
so, and then they dump all those clients and they dump all those clinicians, and it's just like creates a vacuum. And so, yeah, they're part of the problem. They could be part of the solution because they have so much money backing them. But again, it's a startup, so it has to be profitable, and they have people that they have to pay off.
Yeah, I mean, they're selling it's just like, I mean, it's just like Uber and some of these other
Yes.
comp
Yeah, I didn't want to
it's
say it.
just
I'll let you say Uber. But yes, yeah,
yeah, I
like
mean,
for
I can
example, like
say
Uber.
yeah, I mean, it's like, the chance of making a profit, never,
Right.
but somehow valued at, $200 billion. I don't
Hmm.
understand how that works, but somehow they're valued at like 100 times their losses.
Yeah.
The
Yeah.
more
So
the more they lose, the more they're valued. I
yeah.
So what about like I mean so yeah, I guess I have to be careful because it is live and what companies do. Uber's okay, but I wouldn't want to mention a mental health company. Um
We'll do this. If you go to Google and you search for online therapist or online psychologist, your top few sponsored ads on there will be the ones that are usually part of the problem.
Those are the
Um,
monsters.
those are the monsters that have like $200 million in
Yeah.
marketing, easy, and they they're out there. A lot of them have already like come and gone, but there's a few out there that still they've found that little niche, and they're still going. Um, but most therapists would prefer to not be in that scenario because they're stuck being like a contract employee, so then, or a contract worker technically. So that means they're paying a
Hmm.
lot of money out for taxes instead of being a W-2 employee. But eventually, like, I think what's been normalized is so many others that are just therapists are saying like, okay, I can do this on my own. I'll run my own business. They'll probably find somebody that can do the whole like accounting piece, the marketing, get that whole strategy together, and then they're just focusing in on being the therapist. I think that'll happen.
A
Um,
platform you can join, like something like StreamYard, like we're doing here.
yeah,
You find a
yeah, I think
platform, they've got some lead gen or tools for you to go find your own clients and
right.
manage
So,
your own, but they help on the back end.
mhm. and that's basically what I'm doing.
It's kind of what you're doing, right? A lot of
Yeah,
what you're doing.
yeah,
You're giving the money away until you got where there's enough to jump on board, and maybe it'll take you full time, right?
yeah.
You may earn a salary there
Right.
at
Yeah.
some
Hopefully,
point.
at some point. And until then, like there, you have the entities that separated are the ones that are like same thing, same scenario, except for they're contract employees, so contract workers. So
Yeah.
then they're making that much more money because they're not paying all the taxes on there for those guys. So that's why I think it'll take a little while for it to become mainstream because you're gonna have to get entities that come together and say like, hey, let's invest in
I
this for a long term.
I was just gonna say, would you find somebody in Indiana would be your next, find you in Indiana or Kentucky or
Yeah,
Illinois?
so and yeah, I made sure that when I started connecting with clinicians and LinkedIn that I was checking state to state. So what'll happen is I will expand to different states. In fact, like we'll call her my sister, my ex-sister-in-law. So my sister
Hmm.
in Illinois, once she graduates, she's gonna want to work for us, and I have to expand it to Illinois. And basically, I'm like, I know you don't want to do business. I'll do the business piece of it. You just do the therapy aspect of it. And she's that's what she's working towards right now as her goal. Um,
Yeah, very interesting. Well, Neil, we're getting a good spot for maybe some closing thoughts. It's
okay.
been I mean, what an interesting journey you've had.
Yeah.
Uh, from, I mean, if somebody had told you you'd be in the mental health space when you were, checking, I don't know, checking on tubes in Minot, you
Yeah.
probably would have laughed.
I would have been
Uh,
like, oh, I'm the one receiving the mental health. That's what
I
that
would
was.
I'd be the patient probably.
Yes.
But here you are, and kind of following life, and ended up kind of solving a problem.
Yeah. Yeah. And it's a huge problem. It's growing. The nice thing
It's
is
a
the
big
stigma is
problem.
going away, so people are seeking mental health.
I think this is one of the things the foundation talks about is, we're four things early on I think I can help with. One is access, and it's partly talking to people like yourself who are trying to solve that problem. And it's clearly access is clearly still a big issue. Um, I think the other one is the stigma still there, still there. And
Yeah.
I think the more we talk about it, the Jar podcast makes it quite regular. I mean, people on there share real stories of overcoming mental health issues, and so it's great. Um, and it's guys, it's men, it's girl, it's the whole spectrum. So we're getting everybody on there saying this is what I went through, and I'm better for it. But sure could have used some tools when I was going through it.
Right.
That would have helped. So education is a big one, I think. So there's the stigma, the cost is the other one. And I think the things you're doing is also addressing the cost and access. I'm a real believer in the online. I think this right here is how we're going to help people. It's the only way to scale and the only way
Yeah.
to get to almost half the people in Ohio, probably.
Yeah. Absolutely. I mean, you can basically be uh, homeless, but you'll see people with a smartphone. So all they have to do is walk over to someplace that has free Wi-Fi, and they can get the help that they need.
They can get the
Not saying
help.
that scenario is happening, but that's how easy it is to access a
It,
therapist these days.
it'd be great if we could get to that space where it's
Yeah,
literally,
absolutely.
somebody with a smartphone and a Wi-Fi could find a therapist online, it, and someone to talk to.
Mhm.
Um, any closing thoughts for the audience? What they can do to help, or just based on
Yeah.
your own experience, any thoughts? Closing thoughts?
Sure. Yeah, I would say that, if you are receiving help, definitely trust the process. And if you don't enjoy your clinician, find one that you do enjoy. You're not stuck anymore. Like even if you're out in the middle of nowhere, you can definitely find somebody online nowadays. And you can afford to be a little picky and find the one that really works and fits well with you. In
Yeah.
which case you'll feel the ramifications from that will just scale for you in a positive way. So definitely just keep searching, and eventually you'll find the one that fits.
Neil, thanks again so much. Neil, founder at Thera Fi, remote counseling, and got his startup going and cranking away in Ohio. I love it. I love it.
Yeah,
Thanks.
thanks,
Thanks.
Ken.
Thanks so much. Thanks everybody for listening and supporting and following the foundation and the things we're trying to do.